Jen, another episode of some documentation, and this time we're going to talk about the Go Bag. So if you recall, when we went over the continuous care visit note, there's a little section here, Go Bag Checked. It isn't just a box to check, it's actually something to do. So we're going to go ahead and talk about that now. So we have 3 different checklists to do with our patients, depending upon what they have. And they have room in them where you can add additional items to the Go Bag. This is a responsibility for each shift that you actually do the Go Bag. So we're gonna look at those lists right now and just briefly talk through them. Lists. So the first list we're gonna talk about is a checklist for a patient that has a G-tube. So these are some of the items that we think are basic items that should be in that Go Bag. But let's first look at the instructions. The Go Bag must be in reach of the patient at all times. Check the power levels of all battery-powered equipment. Have backup power source where available. Verify presence of phone for emergency communication. Check Go Bag at the beginning and end of each shift and before going on all outings. This is your emergency pack, so you really need to do this. So emergency numbers, care plan and med list, CPR barrier device, bulb syringe, gloves, G-tube button, water-soluble lubricant, 5 to 10 cc syringe, 60 milliliter syringe, extension set, medical tape, split gauze or gauze, bottle of water, and formula. You can add things to this if there's something that's patient specific. So that's just a place to start. The next list we have is the Go Bag checklist for someone that has a trach and a G-tube. So same instructions as before. All of the items that were included in the G-tube are there, along with some additional items. If they have a trach, same size or one size smaller, sterile lubricant, trach ties, syringe and blunt scissors, portable suction, charged AC power cord, suction catheters, saline bullets, shoulder roll, HME, ambu bag, and face mask. And some space if there's additional things. And then the third and final checklist is for someone that has a trach, is on a vent, and a G-tube. So all of the G-tube items are there, and all of the items that you needed to have for the trach are right here. The rest of these are ventilator items. So let's go over those just briefly. Ventilator fully charged with batteries, battery cable and car adapter, AC power cord, complete tubing circuit with O2 tubing, shoulder roll, passive condenser HME, inline HME, filter, swivel adapter, MDI adapter if ordered, Luer lock syringe, oxygen, obturator, inner cannula. Again, spaced for adding things, but this is a really important responsibility. If you don't know what these items are, you need to talk to your case manager. And now we're going to take a second and look at actual things that might be in a Go Bag. So these are some of the items you might find in a Go Bag. This is a sample backpack to use, depending upon what you need. Depends upon the size. So if you have just a G-tube, you might have a smaller backpack than if you had someone that's got a ventilator, a trach, and a G-tube. So what I've laid out here are some items. So here's a G-tube with feeding and extension tubing set, split gauze, lubricating jelly. This is a bag for G-tube feeding, bulb syringe, micro shield, 6 cc syringe, 60 milliliter syringe, and then some tape. These are some items you might need for a patient that has a trach or a ventilator, suction tubing, HME, which is a heat moisture exchanger. This is one kind. There's multiple kinds. This is one that does not allow for suctioning or adding oxygen, but there are some that have that. 2 different size trachs, the one that's in the patient and one size smaller. You need to have them. Another small syringe, lubricating jelly, gloves, ambu bag. If the person does not have a trach and you want to have an ambu bag, let's say they have respiratory issues, you'd need the face mask piece. That is not on this. We're assuming this person has a trach. And then trach ties. So this isn't everything that's on the list, but just some example of some of the things that you might want to have in there. So take your time, check that Go Bag. It's well worth doing. See you next time.